Hello, this is Dr. Dorwit, and this is Anatomy and Physiology 1, Lab 4, the skeleton. The skeleton is made of 206 bones. The skeleton has two divisions, the axial skeleton and the appendicular skeleton. Let's discuss the divisions of the skeleton. The axial skeleton consists of the bones that are in the middle of the body's center of gravity. Axial comes from the word axis, like what the earth spins around. The appendicular skeleton consists of the bones of the limbs. The word appendage means an attachment. It comes from the word appendix, like an appendix in a textbook. Bones come in different shapes. Bones can be long, short, flat, or irregular. Long bones are much longer than they are wide. Long bones can be small or large. Long refers to the shape, not the size. Long bones include the bones of the arm, forearm, and fingers, and bones of the thigh, leg, and toes. Long bones have a cylindrical shape. Short bones are equally as long as they are wide, like a cube. They include the bones of the wrists and ankles. Short bones also include the sesamoid bones. The word sesamoid comes from sesame seed. These are bones that are found in tendons, like the kneecap or the patella, which is found within the quadriceps tendon. Flat bones are thin, and they're never completely flat. They usually have a slight curve to them. Flat bones include the ribs, the breastbone, shoulder blades, and most of the bones of the skull. Irregular bones don't fit into any of the other categories. Irregular bones include the bones of the spine, the vertebrae, and the hip bones. Bone markings. Bones are not flat. Even flat bones are not perfectly flat. Bones have a terrain. There are areas that are raised. There are areas that are lowered. There are holes. And there are areas that don't fit neatly into any of the above categories. All of these areas are called bone markings. The areas that are raised are called projections. The areas that are lowered are called depressions and openings. What do projections do? Projections are points of attachment for muscles and ligaments, and projections help to form joints. The first projection we're going to discuss is the tuberosity. A tuberosity is a large, rounded projection. In plain English, it's a big, round bump. Tuber means knob. This is a picture of the tibial tuberosity. This is easy for you to feel. Feel your patella. Then with your fingers, go straight down to the top of the tibia. Feel that big round bump? That's the tibial tuberosity. Crest. A crest is a narrow ridge of bone. A crest is like a peak. The iliac crest is where you rest your hands when you put your hands on your hips. Trochanter. A trochanter is a very large, blunt, and irregularly shaped projection. There are only two trochanters in the entire skeleton, and they are both located on the femur or thigh bone. Trochanter means runner. Line. A line is a narrow ridge of bone that is smaller than a crest. In this picture, we see lines on the posterior surface of the femur. A tubercle. Tubercle is a small, rounded projection which is like a tuberosity but smaller. This illustration shows the greater tubercle of the humerus. A condyle. Condyle is a rounded projection within a joint. Epicondyle. An epicondyle is a raised area on or above a condyle. This illustration shows the posterior surface of the femur, and condyle points to a part of the femur that participates in the knee joint, and epicondyle is that tiny bump that's just above it. Condyle means knuckle. The condyles look like a pair of knuckles. Spine. A spine is a sharp, slender, often pointed projection. Spine means thorn. This is an illustration of a spine on a typical vertebra. Process. A process is a general name for a projection. This illustration shows the mastoid process. The mastoid process is easy for you to feel. Touch your ear, then use your finger to go back about an inch and down an inch. Feel that bump? That's the mastoid process. Head and neck. The head and neck of the femur are perfect textbook examples of a head and neck. A head is a bony expansion carried on a narrow neck. More projections. A facet. A facet is a smooth, nearly flat surface that forms one side of a joint. This illustration shows facets on a vertebra. Ramus. A ramus is an arm-like bar of bone. This illustration shows the ramus of a mandible. Now let's discuss depressions and openings. What do depressions and openings do? Depressions and openings allow blood vessels and nerves to pass through bones. Here is a cavity. This is a sinus cavity. It's an air-filled space within a bone. It's the source of sinus headaches. Meatus. A meatus is a canal-like passageway. The example here is the external auditory meatus. Easy to identify because it is located just underlying the ear. Fossa. A fossa is a shallow, basin-like depression, like a sinkhole or a wide valley. This is an illustration of the scapula or shoulder blade, and it shows the fossa that's on the anterior side of the scapula. Groove. A groove is a furrow, just like in plain English. Fissure. A fissure is a narrow, slit-like opening, in other words, a crack. Foramen. A foramen is a round or oval opening, in other words, a hole. This is the end of the narration for the first part of Anatomy and Physiology 1, Lab 4, the skeleton. We will continue with the second part of the narration, which will include the axial skeleton, including the skull, the hyoid bone, and the ribs, and the vertebrae.